that strikes fear into the hearts of many. But what exactly is cancer? Cancer is a disease characterized by the uncontrolled growth of cells in a part of the body. These cells can proliferate and spread to other parts of the body if left unchecked. It has the potential to originate in nearly every part of the body, consisting of trillions of cells. One type of cancer that starts as a growth of cells in the lung is lung cancer. Lung cancer is the leading cause of cancer death, claiming the lives of 130,000 people each year. Understanding the lung cancer is crucial in combating this formidable illness.
Professor, now that I know what lung cancer is, what is the primary cause of such a dangerous cancer?
Smoking is by far the leading cause of lung cancer, responsible for 80 to 90% of all lung cancer cases. It damages the cell linings of the lungs significantly with the carcinogens in the cigarette. At first, your body may be able to repair this damage, but with repeated exposure, further stress is added to these cells. Hence, there will be a greater chance of having a genetic mutation that results in cancer.
So are there any other risk factors for lung cancer?
Yes. Exposure to secondhand smoke, radon gas, and carcinogens, as well as genetic factors, age, and lifestyle choices can also increase the likelihood of developing lung cancer.
Alright, but how exactly does a genetic mutation develop into cancer?
You see, normally healthy cells follow the instructions of certain genes to grow and reproduce at a controlled pace. The proto-oncogenes control and promote cell growth. The tumor suppressor genes prevent the formation of unnecessary cells, and the DNA repair genes fix the DNA in mutated cells or signal it to die through a process named apoptosis if the mistake can't be repaired. Oncogenes, the mutated proto-oncogenes, however, can disrupt the process. They interfere with control points of the cell cycle, signal the cell to ignore DNA damages and continue replicating, avoid apoptosis, and promote metastasis and angiogenesis, meaning that the tumor can spread and has its own blood supply. To have a better understanding, let's look at the stages of lung cancer. In stage 0, a small tumor is formed due to the rapid division of cells, but doesn't yet invade the other structures. Next, the tumor starts to spread to the nearby tissues. Soon after, it begins metastasizing to the neighboring lymph nodes in stage 2 as its blood vessels start to develop, and further into the chest and the lymphatic system in stage 3. Ultimately, in stage 4, the cancer will spread widely into different parts of the body.
So what about the other two types of genes?
Normally, with TSJ and DNA repair genes, the risk of getting cancer is reduced even if an oncogene is present. However, if they also undergo mutations, the restrictions on tumor development are minimized. Sometimes people misunderstand that a tumor equals cancer, but that's not true. The other type is called benign tumor, which is uncancerous and usually doesn't cause serious problems in the patient's body. This is because they have clear borders and do not metastasize, nor do they divide and grow as rapidly as malignant tumors. DNA damage is still commonly involved in benign tumors, but the mistakes are not as significant. For instance, an oncogene may be present, but tumor growth is highly restricted by the TSJ and DNA repair genes.
Oh, now finally I understand. So are there any early symptoms that may signal the development of this disease?
Absolutely. Common ones include frequently having a dry and irritating cough, sputum with blood, and the dull pain in the chest. If signs of dyspnea, which is characterized by the shortness of breath, and hoarseness start to emerge, then you should take tests to identify its causes. As the tumor develops, these symptoms become much more noticeable and painful, and are usually accompanied by the loss of appetite and a sense of tiredness. As the cancer cells spread to other organs in the body, discomfort in those regions will also arise.
If it's such a severe yet common disease, then numerous treatments must be developed for it, right?
Indeed, a variety of therapies are available, including chemotherapy, immunotherapy, targeted drug therapy, and hormone therapy that uses drugs or hormones, as well as surgery, radiation therapy, and ablation that targets specific regions of the body where the tumor is located.
Can you explain how the most common types of treatments work?
Sure. Then we'll focus on chemotherapy and radiation therapy. Chemotherapy aims to deactivate and kill cancerous cells using drugs, which works with the cell cycle and targets its different phases. It can do this in various ways, including damaging a cell's DNA to keep it from dividing, act as substitute of the building blocks of RNA, Although it cannot differentiate healthy cells from cancer cells, but the rapid and irregular division of cancer cells makes it a better target. On the other hand, radiation therapy only affects the target area of the tumor. It uses radiation to create small breaks in the DNA of the cancer cells to prevent them from replicating. The two main types of radiation therapy are external and internal beaming, depending on where the source of radiation is. For lung cancer, the external method is used to treat cancer in the primary and metastatic sites, while the internal method treats the tumor in the airway to alleviate symptoms.
Which of the treatments is the most effective?
Generally, chemotherapy is more effective, especially after a cancer starts to metastasize. This is because it can efficiently kill cancer cells, and not only the sites are identified, but also the hidden ones. It's also suitable for most people and doesn't have strict requirements on the condition of the patient, like surgical therapies. Yet more commonly, radiation therapy and chemotherapy are used together, since with the presence of drugs, the cancer cells get more sensitive to radiation, hence a more effective treatment.
Then, why have heard so many people say that the process is so difficult?
Because it is from various aspects. First, cancer cells in a patient's body aren't identical and have variations among them, thus facilitating tumor reformation. After long-term usage, the cancer cells will also develop resistance to the drug. Moreover, all treatments have some form of side effect, making it difficult to balance between treating cancer and managing their side effects. Due to all the difficulties encountered, lung cancer has a significant impact on society.
Can you specify the impacts?
First, there is a significant economic impact. This is primarily due to the high cost of treatment with the usage of medical devices, drugs, and personnel, which impose a substantial financial burden on families. In addition, the prolonged treatment often leads to job resignations or reduced working hours, contributing to wastage of human resources. The social impact of lung cancer is also profound. Financial issues, for instance, often lead to tension and conflict among family members. Additionally, physical discomfort and changes in condition associated with cancer treatment reduce the quality of life for both patients and their families, further straining social bonds. Psychologically, the patients often experience heightened anxiety and depression due to the uncertainty of treatment outcomes, while their family members and friends face stress and emotional exhaustion as they shoulder caregiving responsibilities.
Lastly, we should clarify the common misconceptions regarding cancer. First, cancer is genetic. Cancer can be influenced by genetics. For instance, a person can be born with oncogene and have a greater chance of getting cancer. However, this isn't 100%. And other factors, such as chance and radiation, also play a vital role in determining the development of cancer. Second, cancer is contagious. Cancer is a genetic mutation and it cannot be passed to another person through conventional methods. The disease and infections are spread, and thus is not infectious. Third, cancer is a death sentence. With treatment, 71.3% of everybody diagnosed with cancer of all types were able to live for 5 or more years. There have been survivors for every type of cancer documented. Therefore, it is crucial to discern the facts from these common misconceptions and always maintain a positive outlook. To conclude, lung cancer is one of the most common forms of cancer, a complex disease characterized by the development of malignant tumors in our body. Causes include DNA mutations, with smoking being a significant risk factor. Treatments like chemotherapy and radiation therapy target cancer cells but can have side effects. The social impact includes causing financial hardships and psychological issues for patients and families. It is essential to understand lung cancer accurately to address misconceptions and know what effective treatment options lies within.